If you asked most doctors what the best exercise for blood pressure is, they'd say cardio. Go for a run, get on a bike, get your heart rate up. That's been the standard advice for decades. I used to say the same thing. Turns out the single most effective exercise for lowering blood pressure is holding perfectly still against a wall. A massive meta-analysis published in the British Journal of Sports Medicine in 2023 looked at 270 randomized controlled trials involving nearly 16,000 people, and the clear winner wasn't running. It wasn't cycling. It wasn't even weight training. It was isometric exercise, things like wall squats and planks, and the blood pressure reduction was almost double what you get from traditional cardio. That's just one of the things I'm going to walk you through today. In this video, I'm covering 10 evidence-based strategies to lower your blood pressure naturally, and I'm going to explain the mechanisms behind each one so you actually understand why they work. Some of these you've heard before but probably don't fully understand. And some of them I guarantee nobody has told you about. I review the latest clinical research so I can give you information that's actually useful, not just generic advice you've already heard 100 times. Now, before we get into the strategies, I want you to meet someone. Margaret is 54. She's a high school teacher in Portland, Oregon. Every morning before school, she walks for 40 minutes. She eats what most people would call a clean diet: salads, grilled chicken, avocado bowls. She doesn't take any medications. She's disciplined. She's consistent. She's doing everything she thinks she's supposed to do. And at her last checkup, her blood pressure was 148/92. Her doctor suggested medication. She said no. She doubled down on her routine, walked longer, cut out red meat entirely, came back 6 months later, 151/94, higher, despite doing more. Margaret's story isn't unusual, and by the end of this video, you'll understand exactly why her blood pressure wasn't budging and what she eventually changed that brought it down by over 20 points without a single medication. Let's start with the foundation, the DASH diet. And I know you've probably heard of it, but most people think it just means eat more vegetables. That's not what makes DASH work. DASH stands for Dietary Approaches to Stop Hypertension. It was tested in a landmark trial published in the New England Journal of Medicine with 459 participants. After just 8 weeks, the DASH diet lowered systolic blood pressure by 5.5 points in the general group. But here's what most people miss. In people who already had hypertension, the reduction was 11.4 points. That's comparable to what you'd see from a blood pressure medication. A meta-analysis of 17 randomized controlled trials with over 2,500 participants confirmed a reduction of nearly 7 points systolic and 3.5 points diastolic. So what makes DASH different from just eating healthy? It's the specific combination of minerals: high potassium, high calcium, high magnesium, high fiber, and low sodium. That combination creates a biochemical shift in your body. It promotes natriuresis, which means your kidneys start excreting more sodium. It inhibits the renin-angiotensin system, which is one of the main hormonal drivers of high blood pressure. And it directly improves endothelial function, which is the ability of your blood vessels to relax and dilate. Basically, it's not about eating more salad. It's about feeding your body the specific minerals that allow your cardiovascular system to function the way it's supposed to. A day on DASH looks something like this: oatmeal with berries and a banana for breakfast, a large spinach salad with beans, sweet potato, and olive oil for lunch, grilled salmon with roasted vegetables and brown rice for dinner, a handful of almonds as a snack, low-fat yogurt, and the key piece: keeping your sodium below 2,000 milligrams for the entire day. Which brings me to the second point, sodium. And this is where most people get it completely wrong. When I talk to patients about reducing sodium, the first thing they do is put away the salt shaker. And look, I appreciate the effort, but that's not where your sodium is coming from. Added salt from cooking and the table accounts for a small fraction of total intake. The real number? About 80% of the sodium Americans consume comes from processed foods and restaurant meals. Let me give you a real example. Picture one of those healthy-looking Mediterranean bowls you'd order from a fast casual restaurant. Grilled chicken, quinoa, hummus, feta, olives, a little tahini dressing. Looks great. That single bowl can contain over 2,400 milligrams of sodium. That's more than your entire daily limit in one meal. Now here's the mechanism. When you eat excess sodium, your body holds onto water to dilute it. More water in your bloodstream means more volume. More volume means more pressure against the walls of your blood vessels. Your heart has to pump harder, your vessels stiffen over time, and the damage accumulates silently. And it's not just your blood vessels. Excess sodium directly damages your kidneys, impairs their ability to filter properly, and affects your brain. Now, I want to tell you about one of the most remarkable public health experiments in modern history. In the late 1970s, Finland had the highest rate of heart disease mortality in the world. Their average salt intake was about 14 grams per day, which is massive, so the government launched the North Karelia Project. They required warning labels on high-salt foods. They promoted low-sodium alternatives. They worked with the food industry to reformulate products. Even McDonald's released a low-sodium hamburger in Finland. Over the next 3 decades, average salt intake dropped from 14 grams to under 9 grams per day. Average blood pressure fell by more than 10 points. And the result? Death rates from heart attack and stroke in the working-age population dropped by 80%. Life expectancy went up by several years for both men and women, 80%, from a public health intervention centered on sodium. And this is where Margaret's story starts to make more sense. She thought she was eating clean, but her go-to lunch was a restaurant bowl that she hadn't bothered to check the sodium content of. 2,400 milligrams, 5 days a week. Her healthy diet was quietly undermining everything else she was doing. Now, there's another side to this equation that most people overlook entirely. Potassium. You can almost think of potassium as sodium's antidote. Where sodium stiffens your blood vessels, potassium relaxes them. Where sodium causes your kidneys to hold onto water, potassium helps your kidneys flush out the excess sodium through your urine. They work in direct opposition at the cellular level. Studies consistently show that increasing potassium-rich foods can lower blood pressure by 5 to 7 points. And yet, most Americans get less than half the recommended daily intake of potassium. The best sources are bananas, sweet potatoes, spinach, white beans, oranges, and avocados. These are foods that should show up in your diet every single day. One important caveat: if you have kidney disease, or if you take medications that affect potassium levels, like certain blood pressure drugs or potassium-sparing diuretics, increasing potassium without medical guidance can be dangerous. Talk to your doctor first. Here's where it gets interesting. There's a pathway in your body that most people have never heard of, and it might be one of the most powerful natural blood pressure regulators we know of. It's called the nitrate-nitrite-nitric oxide pathway. Here's how it works. You eat foods high in dietary nitrate, beets, arugula, spinach, celery. Those nitrates get absorbed in your small intestine and enter your bloodstream. But here's the fascinating part. About 20 to 25% of those nitrates get pulled back out of your blood by your salivary glands and concentrated in your saliva. Specific bacteria living on the back of your tongue then convert those nitrates into nitrites. You swallow the nitrites. They reach your stomach. Your stomach acid converts them into nitric oxide. The nitric oxide enters your bloodstream. It activates an enzyme called guanylate cyclase inside the smooth muscle cells of your blood vessel walls. That enzyme produces a molecule called cyclic GMP, and cyclic GMP tells your blood vessel muscles to relax. Your vessels dilate, your blood pressure drops. Basically, there are bacteria on your tongue that help you make a molecule that relaxes your blood vessels. And you've been carrying this system around your whole life without knowing it. A meta-analysis of randomized clinical trials found that beetroot juice lowered systolic blood pressure by about 3.5 points. In people with hypertension, the effect was even larger, comparable to what you'd get from a single blood pressure medication. And here's the thing. There's a way you might be sabotaging this entire pathway without realizing it. Antibacterial mouthwash, the kind that contains chlorhexidine or cetylpyridinium chloride. These mouthwashes kill the bacteria on your tongue that convert nitrates into nitrites. No bacteria, no conversion, no nitric oxide. Your blood vessels lose one of their most important relaxation signals. I'll be honest, I didn't expect this one when I first came across the research, but the data is consistent. If you're using antibacterial mouthwash twice a day, you may be undermining your body's nitric oxide production. Margaret used an antibacterial mouthwash every morning and every night for years. It was just part of her routine. Nobody told her it might matter. Now let's talk about the finding that surprised the entire exercise science community. I mentioned the BMJ meta-analysis at the beginning. Let me give you the full picture. 270 randomized controlled trials, nearly 16,000 participants. The researchers compared 5 categories of exercise: aerobic, dynamic resistance training like squats and push-ups, combined training, high-intensity interval training, and isometric exercise. The reductions in systolic blood pressure were as follows. Aerobic exercise lowered it by about 4.5 points. Dynamic resistance training, about 4.5 as well. Combined training, about 6 points. High-intensity interval training, about 4 points. And isometric exercise training lowered it by 8.24 points, almost double. When they ranked the exercise types by effectiveness, isometric exercise came in at 98.3% on the probability scale. The next closest was combined training at 75.7%. It wasn't even close. And when they drilled down into specific exercises, the wall squat came out on top for lowering systolic blood pressure. Now, a separate randomized controlled trial in 2023 tested this directly in 77 people with untreated hypertension. They compared wall squats to hand grip exercises to a control group. After 12 weeks, the wall squat group dropped their systolic blood pressure by 12.9 points. The hand grip group dropped by 11.2. The control group barely moved. And here's what makes this practical. The protocol is 4 sets of 2 minutes with 2 minutes of rest between sets, 3 times a week. That's 14 minutes per session, 42 minutes per week total. And when they switched to just 1 session per week for maintenance, the wall squat group held onto their improvements better than the hand grip group. What I found striking is the contrast. Most people assume you need 30 to 60 minutes of cardio to make a dent in blood pressure. This data says you can get a bigger effect in 14 minutes with no equipment, no gym, just a wall. Now, does this mean you should stop doing cardio? No. Every type of exercise in that meta-analysis lowered blood pressure. Cardio is still great for your heart, your metabolism, your mental health. But if your specific goal is to lower blood pressure as efficiently as possible, the evidence says isometric exercise should be part of your routine. Here's a quick overview of the next few strategies that are important but more straightforward. Weight loss. For every kilogram you lose, which is about 2.2 pounds, your blood pressure drops by approximately 1 point. And it's not just the number on the scale. Losing excess body fat reduces the volume of blood your heart has to pump, decreases systemic inflammation, and improves insulin sensitivity. Obesity also increases aldosterone, a hormone that makes your kidneys hold onto sodium, which creates a vicious cycle. Breaking that cycle with even modest weight loss can produce measurable results. Alcohol. This one surprises a lot of people. Alcohol might make you feel relaxed, but it actually raises your blood pressure. It activates your sympathetic nervous system. It causes direct vasoconstriction. And the effect is dose dependent, meaning the more you drink, the worse it gets. More than 2 drinks per day has a significant impact. The 2024 European Society of Cardiology guidelines tightened their recommendations on alcohol for this exact reason. Smoking. Nicotine causes acute vasoconstriction every time you smoke. But the long-term damage is worse. Smoking destroys the inner lining of your blood vessels, the endothelium. Remember that nitric oxide pathway we talked about? Your endothelium is where a huge amount of your nitric oxide is produced. Damage it, and you lose one of your body's most important blood pressure regulators. The effects compound over years. Now, here's a strategy that almost nobody talks about when it comes to blood pressure, and it's one of the most exciting areas of research right now, your gut microbiome. In 2024, the American Heart Association released a dedicated science advisory on the connection between gut bacteria and blood pressure. That's how seriously the scientific community is taking this. Here's the mechanism. When you eat fiber, the beneficial bacteria in your gut ferment it and produce short-chain fatty acids, particularly butyrate. Butyrate activates receptors called GPR43 on the cells lining your blood vessels. This improves endothelial function. It also strengthens the integrity of your intestinal barrier, the wall of your gut. Why does that matter for blood pressure? When your gut barrier is intact, it keeps bacterial toxins inside your intestines where they belong. But when that barrier breaks down, a condition sometimes called leaky gut, bacterial fragments called lipopolysaccharides leak into your bloodstream. Your immune system detects them. It mounts an inflammatory response. That inflammation damages your blood vessel walls. Your vessels stiffen, your blood pressure goes up, Basically, the health of your gut wall directly affects the health of your blood vessel walls. They're connected through inflammation. And there's another pathway. Certain gut bacteria produce a molecule called TMAO, trimethylamine N oxide, which promotes atherosclerosis and increases vascular stiffness. The more dysbiotic your gut, the more TMAO you produce and the stiffer your arteries become. A phase 2 randomized clinical trial published in Nature Cardiovascular Research in 2023 tested a specific prebiotic called HAMSAB in people with untreated high blood pressure. It lowered their blood pressure. And a Mendelian randomization study in 2025 confirmed a causal link between microbial metabolites and blood pressure regulation. This isn't just correlation anymore. The evidence for causation is building. So what do you do with this information? Eat more fiber. Research suggests that every additional 5 grams of fiber per day is associated with a 2.8-point reduction in systolic blood pressure. Eat fermented foods, yogurt, kimchi, sauerkraut, kefir. These introduce beneficial bacteria directly and reduce ultra-processed foods which tend to promote the wrong types of gut bacteria. And it's not just your blood vessels, the gut-brain axis, the gut-kidney axis, the gut-heart axis. These are all active areas of research showing that what happens in your digestive tract reverberates through your entire cardiovascular system. Now, the final one. And this is the one I think matters most because it affects the largest number of people and is almost never checked. Sleep. Let me start with the basics. Sleeping less than 6 hours per night is associated with a significantly higher risk of developing hypertension. The Sleep Heart Health Study found that the optimal window is 7 to 8 hours. Above or below that, risk goes up, but there's something much bigger hiding here. Some people can sleep 8 hours and still wake up exhausted. Their blood pressure won't respond to diet changes. It won't respond to exercise. Sometimes it won't even respond to medication. This is what's called resistant hypertension, and there's one condition that shows up in these patients at a staggering rate: obstructive sleep apnea. Here's what happens. When you fall asleep, the muscles in your throat relax. In some people, they relax too much. The airway narrows or collapses completely. Air can't get through. Your oxygen levels drop. Your brain registers a crisis. It sends an alarm signal. Your sympathetic nervous system fires. Adrenaline surges. Your blood vessels constrict. Your blood pressure spikes. And then you partially wake up, just enough to gasp for air. Your airway opens. You fall back asleep. And it happens again and again, 30, 40, 50 times a night, every single night, for years, sometimes decades. Each one of those episodes is a surge of adrenaline, a spike in blood pressure, a wave of oxidative stress hitting your blood vessel walls. Over time, this drives vascular remodeling. Your arteries physically change. They become stiffer. Your blood pressure stays elevated, not just at night, but during the day. Your body's baseline shifts upward. Basically, sleep apnea turns every night into a cardiovascular stress test that your body never recovers from, and the numbers are stunning. A study of over 400 patients with resistant hypertension found that 82% of them had obstructive sleep apnea. 82%. And in cross-sectional studies, the prevalence ranges from 60 to 71%. Most of these people don't know they have it. What most people don't realize is that sleep apnea doesn't just cause nighttime hypertension. The sympathetic nervous system stays overactive during the day too. These patients show a non-dipping pattern on ambulatory blood pressure monitoring, meaning their blood pressure doesn't decrease at night the way it should. This non-dipping pattern is one of the strongest predictors of cardiovascular damage. If your blood pressure isn't responding to 3 or more medications, if your partner tells you that you snore loudly or that you stop breathing at night, if you're exhausted during the day, even after what should have been a full night's sleep, these are signs. And the standard workup wasn't designed to look for this. You have to ask. The test is called polysomnography. It's a sleep study, either in a lab or with a home kit. It measures your breathing, your oxygen levels, and your brain waves while you sleep. And if it confirms sleep apnea, treatment with CPAP, continuous positive airway pressure, can lower blood pressure, though the effect is modest and most patients still need medication alongside it. But without treating the apnea, those medications are fighting against a system that's being destabilized every single night. And here's what happened with Margaret. Her husband had been telling her for years that she snored loudly, that sometimes she'd stop breathing and then gasp. She dismissed it. She thought snoring was just snoring. When she finally got a sleep study, It showed moderate obstructive sleep apnea, 31 events per hour, every hour, all night. She started CPAP. She switched from antibacterial mouthwash to a simple fluoride rinse. She started checking sodium content before ordering at restaurants and was shocked at what she found. She added a wall squat routine 3 mornings a week, 14 minutes. 4 months later, her blood pressure was 128/82, down from 151/94. No medication, not because she suddenly discovered willpower. She'd always had willpower. What she didn't have was the right information. So here's the big picture. Blood pressure isn't just about salt and exercise. It's a system. Your gut bacteria are producing molecules that affect your vessel walls. The bacteria on your tongue are generating nitric oxide that relaxes your arteries. Your sleep is either restoring your cardiovascular system every night or silently destroying it. And the sodium you don't see is doing more damage than the sodium you add yourself. The good news is that every single one of these is something you can address, not all at once. Sustainability matters more than intensity. Pick one thing, just one. If you've never tried a wall squat, try 4 sets of 2 minutes tomorrow morning. If you've never looked at the sodium content of your regular lunch order, check it this week. If your partner says you snore and you've been ignoring it, don't ignore it anymore. Make the appointment. Every year spent with uncontrolled blood pressure is a year of silent, cumulative damage to your blood vessels, your kidneys, your brain. But the research is clear. These changes work. They often work faster than people expect. Margaret's blood pressure dropped 23 points in 4 months, not from a new drug, from understanding what was actually going on. So which one of these strategies are you going to start with? Drop a comment and let me know. I read every single one. And if you found this helpful, share it with someone in your life who's dealing with blood pressure issues. Hypertension affects over 1 billion people worldwide, and most of them don't have the information we just covered. Take care of yourselves. I'll see you in the next one.